Hello, my name is Danielle Wood. I direct the Space-Enabled Research Group at the MIT Media Lab. Let me share with you the work we are doing in response to the COVID-19 pandemic. In particular, we are creating the VIDA Decision Support System Framework. It's a flexible framework that can bring together several types of data, including geospatial data, to help government leaders at the local and regional level better use data to inform their COVID management policies. In particular, we have brought together a team of experts, including from Harvard, East Carolina University, and Blue Raster, a data analytics firm. We're helping understand different data types and how to integrate them together to be more user-friendly for decision makers. We're in dialogue with several countries and the leaders who are directly responding to COVID issues in the countries of Mexico, Brazil, Indonesia, South Africa, Chile, and Angola. We'd love to have you join our team and the global VIDA Decision Support System Collaboration Network. I'll give you an example now of how VIDA can be used. It's a conceptual example showing the potential in the case of Chile and Brazil. VIDA is a framework, and it can be customized to each location. This is a generically relevant part of VIDA that can be brought to different forms depending on where you are. VIDA brings together 4 kinds of models and integrates the information from each model to inform the next model. In particular, it starts with public health, obviously a key aspect of the VIDA analysis. We're either taking direct reports from governments of the number of COVID cases they have, or we can work with our colleagues at Harvard to build system dynamics models that help to estimate the future path of the COVID cases, trying to understand how many people in a population are susceptible, exposed, infected, or recovered from COVID. We also think about the environment. Many factors of human activity are changing due to COVID policies, so there are possible ways to measure that by understanding changes in water quality, air quality, urban heat, and land use. The socioeconomic model is key because we want to understand how people are more vulnerable due to COVID policies, such as in their economic, housing, and employment factors. Public policy focuses on asking how governments can take the information about public health, the environment, and socioeconomic outcomes to try to inform their planning for how to put in place social distancing and business management in order to just have outcomes they desire for their region. The technology design model is meant to help talk about the kinds of investments governments can make in areas like testing, as well as in information systems or contact tracing to better have knowledge of public health and seeing how things are changing over time due to COVID. This can be customized to local areas. We're going to show you a few examples from the city of Santiago, the capital of Chile. It's one of the areas that's been hit most difficultly by COVID. We'll also see a few examples from Rio de Janeiro in Brazil. As we mentioned, the public health model can draw from currently available data. In this case, we can show examples from the public data provided by the government of Chile, showing the number of active cases, confirmed cases, new cases, those in hospitals, tests that have been completed, and patients that have died. This current system that's already available from the government of Chile also shows the number of cases in different local regions, helps people ask if they are seeing a lot of cases in the area where they live. This is one example that is also broken down by neighborhood in the major city of Santiago. The environmental model considers publicly available data or new data sets to ask what's changed in the environment during the COVID period. Of course, in many regions of the world, there's been a change in commuting and a change in different industrial activities. Sometimes this leads to a change in air quality and the level of pollutants. So in the case of Chile, there's government data about air quality in different regions, and we can check over time to see if we're seeing increases or decreases in air quality during the COVID pandemic. Similarly, we've been experiencing different examples of studying water quality in areas like Rio de Janeiro, using commercial data as well as government data, and trying to understand if there's a change as people move differently across urban areas like Rio. We're asking whether we can use satellite data to monitor traffic. Here's a case where the data that's easily available from commercial providers doesn't give you a direct measurement of individual cars, but you may be able to infer whether a parking lot is empty or full by comparing it to dates where you know there's more activity or less. The socioeconomic model can be drawn both from qualitative interviews and quantitative surveys. The purpose of this model is to help inform decision makers about the kinds of communities that are experiencing social vulnerability during COVID. This may be based on understanding people's employment area. For example, this map highlights people working in the agricultural sector in Rio de Janeiro. It's also helpful to understand the changes both historically and currently during COVID in areas like unemployment. So this map is coming from public data in the government of Chile, showing unemployment rates by gender for men and women in certain regions of Chile. The Space Enabled Research Group is developing a framework called Individual Security, and we're talking about the impacts of people due to COVID, close here in the Boston area, but also in areas like Chile and Brazil. And we're asking how people are impacted in areas like housing, employment, income, healthcare, wellness, and their family safety. We plan to do a series of interviews in the Boston area, and we're sharing this kind of technique with other colleagues in Chile and Brazil, where they also have similar data collection processes. And ultimately, we hope to get data over time from different communities. So some people are actually interviewed month by month to see how COVID's affecting them. This won't be done to have a large data set, but to give some key stories to help us understand the kinds of vulnerabilities that are common during COVID. The model for public sector decision making is meant to help inform governments about how they can combine the information about public health, the environment, socioeconomic outcomes, and technology investments to decide what kind of policies to put in place to promote public health, to increase social distancing, to support businesses, and to create social safety nets. This part also considers whether organizations want to invest in new technology. We've seen a lot of discussion around technology during the COVID crisis, a need for better testing and faster testing kits, a need for ventilators in hospitals, and the need for tools to improve contact tracing or understanding the compliance for social distancing. One decision governments need to make is whether to invest in certain kinds of technology, given that they don't have unlimited funds. In Chile, for example, there may be tools that are also brought into place during the reopening to better understand if people are healthy or sick as they start to interact more in businesses and schools. This is just giving you an example of the vision we have for the VIDA decision support system. As I mentioned, we're working with several organizations that are based in government or university teams in Chile, Mexico, Brazil, Angola, South Africa, and Indonesia. You're very welcome to join this team. We're building the global VIDA collaboration network, all teams that are interested in increasing the use of decision support systems to make our response to COVID more effective. Thanks so much for listening.